it's great to be joined by Dr. Laurencin, Conviva Care Center here on the north side, one of 11 locations, and great to talk to you, but a serious subject today, diabetes. So a lot of folks are asking, what is diabetes?
That is a very good question. Diabetes is a chronic inflammatory conditions that affects you from your head to toe.
Okay.
It's basically how your body uses food turned into sugar.
Okay.
And if you have diabetes, that means you have high level of blood sugar.
And Dr. Laurencin, the numbers, unfortunately, for diabetes, they're staggering. Let's talk more about how widespread this is.
Very widespread. Right now, nearly 34 million Americans have diabetes. It's statistically 1 in 10 have it.
Okay, that's a lot of people.
A lot of people. And we want people to recognize the signs and symptoms of diabetes.
Right, so if you don't go to your doctor, make those appointments, this can become very serious very quickly?
Absolutely. So this is one thing that most people need to find out. First of all, we said earlier that, high blood sugar, right? So if you have high blood sugar in your body, the body somehow, I don't know, man, God created this body in such a way that it will try to get rid of sugar naturally for you. So people usually go to the bathroom a lot, they drink a lot of water, and we call it they pee a lot. So that's a very common sign of diabetes.
And doctor, what are the different risk factors for diabetes?
One of the major, there are quite a few. We find that, obesity is one, sedentary lifestyle is one, just people have family history is one, unfortunately. But let me throw this at you also. Not because my parent is diabetic or that runs my whole family, that doesn't mean I'm gonna have diabetes.
Well, that's good, because you always hear family history and you say, oh my gosh, this person in my family has. So there is, if you take care of yourself, that's good.
Absolutely, and that's the thing, because family history holds the gun,
right?
But I hold the trigger.
Okay, I like that. Okay.
So if you do your lifestyle, you watch what you eat, exercise, that can change.
All right,
numbers.
I like what I'm hearing, doctor. So the symptoms you look for, though, and the risk factors, that's very important, because this is affecting 1 out of 10 people, like you said.
Correct.
What kind of things do we look for?
Like we said earlier, there's not one specific symptom for diabetes per se, but somebody who newly diagnosed, they don't know that they have diabetes, they run to the bathroom a lot, they're drinking a lot, they have quite a few UTI, inflammation or infection. Some people can even come to you with a lot of rashes or confusion. There's quite a few out there, and that's what we look for. You mentioned that to us, we do some tests, and boom.
And sometimes it takes a family member noticing their loved one not quite acting right, so they need to make sure they pay attention.
Absolutely, absolutely. So if you see grandma or uncle so-and-so run to the bathroom, feel confused sometimes.
Confused as well.
Absolutely, because I had, someone that I know very well who came in and was confusion. Family member thought that the patient had Alzheimer's, but it was not Alzheimer's. When we did the urine, because when you have confusion in older people, that could be an infection, and boom, there was an infection, and there was glucose, which is sugar. And when I further investigate, diabetes.
Okay.
Undiagnosed.
So doctor, you get to the doctor, you diagnose the patient, all right, and they say you have type 1 diabetes. What are the different types of diabetes? What's the difference between type 1 and type 2 diabetes?
Very good question. Usually type 1 diabetes, your pancreas, which is a gland that produces a hormone called insulin. So that insulin is not there in type 1. So in type 1, you do not have an insulin production. In type 2, you do have insulin, but it is resistant. Okay. In other words, if you eat a meal, you need insulin to transport that sugar to different part of your cells. If you don't have insulin, I need to give you insulin. So that's why in type 1, usually they have insulin every day, they shoot themselves.
Right.
In type 2, on the other hand, they don't need insulin because the body is producing insulin. But what you find out is that because of different lifestyle and the insulin is resistant, so we may still give those individual insulin as well. 2 is more pills and type 1 is more injection.
So where can we go for more information?
As of right now, you just go to meetconviva.com.
Okay, and also the number on the screen below?
See that number and give us a call and we'll be happy to assist.
All right, you owe it to yourself, and thank you so much for just being easy to understand and allow people to know, doctors good people.
Absolutely. We're a human being too. It's like
That's
we
right.
understand, you know. So it has been my pleasure to have been with you. And we simply are here to assist people who are going with this diabetes. And your family, yourself, just give us a call. We'll be happy to assist and make sure that we walk the way with you.
All right, thank you. You can tell Doctor's passion. He cares about you, and you care about you. Make that appointment. And of course, for another look at this segment, head to firstcoastliving.net later today.